Good morning, colleagues. I'm Greg Bamber, and I acknowledge being on the unceded land of the Wurundjeri peoples of the Kulin Nation. My pleasure to be part of this topical symposium hosted by the Academy of the Social Sciences in Australia, and to introduce panel 3. What are the political, social, psychological, social inclusion, health, and other challenges we face in the new normal of living with uncertain pandemic futures? We're lucky enough to have another 4 great panelists who will follow the same procedure as in the earlier panels. Each will take up to 7 minutes. Please put your questions into the Q&A box on your screen, and we'll try to get to them during the Q&A period. So to introduce the panelists, first, Leon Mann, AO, is a social psychologist, a professorial fellow at Melbourne School of Psychological Sciences at Melbourne Uni. He was elected in 1975 as a fellow of this academy and is a past president of it. Glyn Davis, AC, is the CEO of the Paul Ramsay Foundation. He's a distinguished professor of political science at the ANU and chair of the ANZOG Research Committee. He's also a fellow of this academy and a former VC of Melbourne University and Griffith University. Lenore Manderson, AM, is Distinguished Professor of Public Health and Medical Anthropology at Witwatersrand University, South Africa. She's an adjunct professor at Monash. She's also a fellow of this academy and author of a new book, Viral Loads, Anthropologies of Urgency in the Time of COVID. UCL Press are releasing it in the next few weeks, and after the 20th of September, it can be freely downloaded from UCL Press. And Jane Hall is Distinguished Professor Health Economics at UTS and the president of this academy, and of course a long-standing fellow of it. She's also a fellow of the Australian Academy of Health and Medical Sciences. So if we were all together, I'd ask you to join us in welcoming the panel in the usual way, but you can clap wherever you are if you wish. Let's move immediately to Leon Mann, who I'd also like to acknowledge has been very helpful in designing this whole symposium. Take it away, Leon.
Thank you very much, Greg, and good morning all. I'm going to address what are for me personal as well as from my profession and academic discipline of social psychology, questions, challenges, which I think are with us now and are for the foreseeable future and probably for the long-term future. And just to get my attention on what it is that started to crystallize as the big challenge, two biggest challenges that I think we address. The first, getting to 80% target vaccinated adults soon in order to control the virus and to, of course, reduce restrictions and avoid lockdowns, but also how do we get community-wide acceptance and adherence to an assortment of government directives which are there to protect ours and others' personal and social and their health. So, Anna, please, could you put on the Wilcox Cartoon from the Age about a week ago? Do you have it in front of you? Here it is. And what it's about is, of course, a masked up, a protester, I suppose, but at least an advocate, competing with someone who's quite selfish. And what you have on the, in the case of the woman, is someone who represents, I think, somewhere about 70 to 80% of the population. And in the case of the guy, something like 10 to 20% of the population, in which the minority, sometimes very, very noisy, insists on their rights to not comply and not cooperate as against the interests of that are clearly seen by the majority, and in point of fact are really there in the interest of the minority as well. So if we can move the slide, thanks, Anna. The other challenges that I see, that's the first one, and we'll move to the next one, is what I see, please, a shadow pandemic that Peter McGorry in the last panel referred to, is a very clear mental health and psychological toll on the vulnerable. And this will, of course, be children, adolescents. We know the children who are in homeschooling. I'm very much aware of the fact that given a number of my elderly friends, and I check in on them regularly, weekly, some are doing it very, very tough. Others are not doing too badly at all. And a very nice example, which is heartwarming, in our 50th anniversary of the Academy, is the Academy's oldest fellow, Ron Taft, who is in Kew Gardens. He's 101. He's in great shape. He's twice the age plus of our Academy. But I think that what we see is problems of maintaining resilience, of trying to cope, the problems of, for those who are working with the people who are doing it tough, and they see it over and over again repeatedly, is burnout. And as Nancy Baxter in the previous panel suggested, there may even be at some point the danger of social breakdown and violence as people get very angry with one another and their obedience, so to speak, starts to break down. Move to the next slide, please. And as we all are aware, and this is an example of it, finding new ways in which we can connect and interact and meet. We'd all much rather be, as we were planning this one, in the Redmond Barry building on the campus of the University of Melbourne. If we would have shared our anniversary with the 75th birthday of the Melbourne School of Psychological Sciences, but it was not to be. But how we maintain as scholars, as academics, not only our family work-life balance, but also how do we continue to create, to write, to innovate, and to grow. It was actually interesting to hear from what Sarah Wilson said in the very first panel, that some people have actually found that that's an experience in which there may even be growth during this time of adversity. So we'll leave the slides now and we'll just go to full screen. Thanks, Anna. So what's on my mind, the first two challenges? The first one is getting beyond 80%. And what we see is vaccine hesitancy. And a few items from a couple of surveys. The first one, which really was, to me, absolutely astonishing, was from the Murdoch Children's Research Institute, which was looking at vaccine intentions and information needs of samples of Victorians' healthcare workforce. And in March through May, surveys were taken. And it's reported that while there was, and recall this is 3-4 months ago, there was intention to get vaccinated among nurses, doctors, allied health professionals, and around about 75% intended to get vaccinated. Surprised me a little bit, but it wouldn't be 95% or even 100%, but it's considered to be high. However, amongst the personal support workers and workers in residential care or facilities, just for the disabled, it was only 66%. Now, I find that remarkable. And the question I would ask is, why isn't getting vaccinated mandated? Why isn't it totally mandated amongst those who work with the vulnerable and those who are at risk? There are, of course, frontline workers, and there are other people on the move, et cetera, and I hear that that Tasmania will require their healthcare workers to be vaccinated by the end of the month, and police, is it in New South Wales? Ditto. But to me, that's, I can't understand it. There's also the vaccine hesitancy in the general population, and the Melbourne Institute conducts and has conducted for the last 18 months fortnightly surveys on a representative sample of 1,200 adult Australians, and it looks at attitudes towards the pandemic. And in its latest survey published July this year, so a couple of months ago, vaccine hesitancy is given as 21.5% of the adult population.
Leon, would you be able to wrap up, please?
Okay, yeah. My question is, what are the sorts of things that we can actually do in order to reduce vaccine hesitancy? My final point is this, that amongst the vaccine hesitants, there are really two groups or opponents to it. There is 10% who really are undecided, sitting on the fence, and they're the group we've got to look to, and in discussion, if I get a chance, we'll come back to what we might do about that. And then there is another 10% who really are committed opponents, and that is a fact that we may have to live with and see what sort of consequences might follow, which might actually unpick them from their particular hard opposition position. So we'll leave it at that.
Thank you very much, Leon, for your insights. And now, Glyn, over to you.
Look, thank you very much, Greg, for the invitation to join this webinar. It's a delight to talk with colleagues in Social Sciences Week. And like you, I'm speaking this morning from the dining room, which, like the rest of the house, sits on the unceded lands of the Wurundjeri people. It's hard to go past the global pandemic as a teachable moment, and it's been great this morning hearing some really thoughtful social science responses to the pandemic. I particularly love the idea of distinguished philosopher Tony Cody walking the streets of Parkville, carefully counting who's wearing their mask correctly. And since Peter Doherty and I both live in the hood, I hope we pass muster. A coronavirus is a medical fact. It's a public health challenge, and very rightly that's been front and centre to today's discussion. It's great. But as social scientists, we also know that so many aspects of this prolonged crisis are shaped by politics, by the tensions of federalism, by political rivalries, by the rituals of parliamentary politics, by the clash of ideology, what Nancy Baxter in the last session called the framework of blame. And again, it was Tony Cody who pointed out the bitter debates when some contest the legitimacy of government to make choices on behalf of the wider public. And Leon's just shared a cartoon about exactly that theme. Now, to call this a clash of philosophies probably dignifies some pretty grubby self-interest, but then ultimately all politics is about interests, about who gets what, when, and how. But I'd like to spend my brief moment in this on the rather unexpected upside of the COVID crisis, which is the sudden implementation of a large raft of policy ideas which have long been anathema to government, but suddenly become essential. And I'm thinking here in particular, but not only of JobKeeper, which is as close to a universal basic income as we've ever seen in this nation. And we've had all of these arguments about modern monetary theory, and yet suddenly we have this fascinating experiment which suggests that that theory works in practice, but not in theory. Alongside JobKeeper was the very important and significant rise, almost doubling in payments under JobSeeker, which Jeff Baldwin touched on earlier in the morning. That rise in social security payments achieved something profound. It lifted hundreds of thousands of Australians out of poverty. And as Jeff noted, that effect was all too brief because the rate was cut again at the earliest opportunity. But it shows us what's possible. And think about some of the other emergency initiatives to support public health. Free childcare for the parents of essential workers, hotel accommodation for people living on the streets, a moratorium on rent raises in rent and on eviction, Each of these initiatives has long been debated amongst social scientists and, of course, often rejected as unrealistic by policymakers. But come the crisis, those same policymakers could suddenly turn to this deep reservoir of social science expertise and practical suggestions which they could pick up and implement. And in that process, we learned a lot about what's possible. We learned that funding people to stay in jobs rather than to be unemployed mitigates much of the social disruption and the pain that have marked previous recessions. We've learned how reliable access to childcare profoundly improves economic participation for women, which is hardly a revelation, but rarely been demonstrated with such clarity. As Janet McCollum observed this morning, these policy initiatives address the fundamental causes of poverty in our society, the ability to secure employment, access to health and childcare support, security of accommodation so you can go to work. And the research that's been commissioned through COVID has also raised some really disturbing questions. I'm thinking here in particular of work by the Institute of Social Science Research at the University of Queensland, which suggests, though with many caveats on sample size and what you're measuring, but it does suggest that school students in poor communities who already live with great disadvantage experience very little deterioration in school performance despite being locked at home for months. And the disturbing question that raises is, what does this tell us about traditional schooling? You can stay away from a school for months at a time and it doesn't affect your academic attainment. What have we learned about schooling? I think COVID has highlighted a systematic failure that needs attention, and it's the social science research that's made that diagnosis possible. So COVID will be remembered for many lessons, including profound questions about the role of government. And we've learned much about public health, about how our federation can cope with the crisis, about a new welfare economics. And COVID has demonstrated clearly the importance of policy debate and research, the importance of developing and testing a battery of policy ideas that can be implemented at short notice, ideas that keep people in employment, that keep them educated when schools close, that inform the public and allow the essential debate that's the hallmark of a democracy. Our challenge, it seems to me, as we come out of immediate crisis, is to ensure that these lessons are not just summer lightning, instantly forgotten, but continue to illuminate. And that's why we need this Social Sciences Week. And that's why we need this academy. Thank you.
Thank you very much, Glyn. Very profound observations that I hope will return to your remarks and those of other panelists in the Q&A. So if you do have any questions or comments, please add them into the Q&A box. And we now turn to Lenore. Take it away, Lenore.
Thank you. I will just... Okay, so thank you so much for inviting me to speak in this panel and to address some of the issues that really ask us, I think, to contemplate the role of social science in policy and to think about the ways forward. Thank you, Greg, for mentioning the book, which I'm just putting up here so anybody who sees a flash of it on a Twitter feed or Facebook will recognise it, and it is purchasable, but it's also free for download, and it does draw on the experience and authors from 15 or more countries, and I'm really reflecting on that basis, and my concern has been beyond Australia, although for the last 20 months I've been here for obvious reasons and not back where I think I would rather be working and addressing some of these issues. But I want to begin in the spirit in which people have been presenting with a very brief couple of points, which I'll come back to. Firstly, on the 16th of March last year, so nearly 20 months ago, or certainly 18 months ago, 16th of March, I was on South African Broadcasting Commission primetime national TV at 7:10 in the evening for 10 minutes talking about the social implications of COVID. That was quite extraordinary compared to what was happening then. elsewhere in the world when it was still being seen as a Chinese and Italian problem. On the 19th of March that year, I was at 7 a.m. running a Q&A for the Institute of Plumbers of South Africa, and I claimed that with great pride as my greatest exposure as a social scientist, talking about plumbing, water, access to water and crumbling infrastructure, and human rights and the role of plumbers and frontline health workers. And that continued, although on the next day I was on a plane back to Australia. So I want to begin by picking up some of the things that I'd already anticipated then, but have become deeply apparent, and that is the way in which the pandemic has exploited and emphasised, amplified, and the existing inequalities. And we've talked a little bit about that already this morning. And it's created at the same time greater disadvantages and new disadvantages, and revealed new disadvantages that we haven't thought about, even though we might have if we'd had time and if there had been a little bit of engagement with some of the issues that might have emerged during that pandemic. COVID has exposed gaps in economies between countries, in health systems and health services, as well as gaps in ideologies that have impacted on our capacity to respond quickly and appropriately and fairly. And if I could move, sorry, I'm having trouble. So what I want to talk about for South Africa, but also in other countries in Africa, and Kenya, Uganda, Nigeria, Ghana, and Senegal, to an extent, are all countries with the same experience, is firstly the way in which those states had reacted by very early April, at the same time as Australia, to the emerging pandemic. Firstly, in taking advantage of existing grants in South Africa, that was for women, for children, people with disabilities, elders and the unemployed, increasing the value of those grants, and then at the same time introducing a special fund, COVID-19 social relief of distress, and also using existing social insurance mechanisms as well as those for social assistance in order to ensure that people were not left deeply disadvantaged as a result of the economic costs, which in South Africa initially was the harshest lockdown in the world. But lots of things were overlooked, and the first thing that was overlooked there, as has been apparent in most places, was the impact of the pandemic on food insecurity. And that was, and I'll come back to why, infrastructural neglect was a very clear issue, and certainly in South Africa and elsewhere in Africa, as people were enjoined to wash hands, and when 50% of populations didn't have access to regular supplies or reliable supplies of water in the first instance, let alone afford soap. There were long-term health conditions that have been deeply implicated, including where states have drawn back chronic condition care and opted at times for telehealth without thinking through the capacity of people to access telehealth, whether or not they own phones and whether they can afford the data. Sexual minorities were ignored, and that includes sex workers as well as others whose income generation collapsed immediately as lockdown became to be policed. Incarcerated populations, and that of course is a very silenced area to consider, but across Africa that has been a major population that has experienced high levels of serious disease and death, and knock-on effects of unemployment, social exclusion and disentitlements, and that includes in relation to refugees, migrants and people without papers who couldn't access social assistance or social insurance provisions by the state, because you have to have papers and you have to be a citizen to be entitled to them in the first place. Was this a surprise? One of the things that bothered me in South Africa in March last year, and continually is the extent to which people reflect on our capacity to manage COVID based on experiences from the Spanish flu, so-called, from 1918 to 19. And whilst it's convenient to reflect back over a century, we have had to deal with both pandemics since then and continuing pandemics, but also thoughtful responses to them. So I've noted on this slide, HIV/AIDS has been a pandemic for 40 years, and South Africa and other countries. Yes, Greg. You right? I can't hear you, Greg.
I was giving you a polite signal to ask if you can wrap up in the next minute or so.
Sorry. Okay, so HIV and so on. But the forthcoming pandemics that we're looking at are antimicrobial resistance, climate change, and insecurity, compounded by continued exclusion. Now, my key point that I want to make is that I have been involved in, and there has been enormous effort led by the Academy of Science of Africa, which includes all of sub-Saharan Africa, on policy responses with teams. And there's been about 100 odd researchers. I lead the social science team there, working on policy responses. In South Africa, the first year report has already been published on COVID, with, again, social science reporters, social science authors at the front. The Academy for Social Sciences in Africa, and Academy of Science in South Africa, has webinars routinely, and the National Research Foundation has been funding research for the past year. And I think my concern is why social scientists and other academics have not had to lead. They've always been at the front line. And my own feeling is that the social sciences, if that's the case in Africa, then in Australia too, we should see far more involvement of social scientists, and we should be insisting not that we have a role, but insisting that we have a role in leading responses to pandemics, and to ensure that we're included in discussions rather than be having parallel discussions on the side. Thank you, Greg.
Thank you very much, Lenore. And one aspect of this pandemic is that you can serve as a professor in South Africa while living in the same hood as me in Melbourne. And thank you for your anthropological insights. We now move to Jane. Please take it away, Jane.
Thank you very much, Glenn, and thanks for the opportunity to speak from my own perspective rather than just as the president. It's an enjoyable, refreshing change. I want to start, though, by reminding you that although we've been through such turmoil in the last 20 months with COVID, it was followed in this country by incredible levels of bushfire, and before that, amazing drought over a great deal of the country, so that a lot of people have been suffering from all sorts of disruption for a very long period of time. But COVID does something different because it's an infectious disease. And so even if we don't have this sort of altruistic externalities that cause us to care. Yes. Is my internet breaking up?
And your voice is getting rather blurred, so it would be, although it's lovely to see you, I wonder if
I'll switch the video off.
Switch your video
and
off.
Hope that improves. I apologize for this. It's the first time in months that I've had this happen, but yeah. So what we're doing is seeing COVID followed by drought and bushfire. So series of disasters that have shaken our society one way or another. But I think the difference with COVID is that it's an infectious disease, so everyone's at risk. And there's a clear selfish interest in reducing the spread of infectious disease, because every one person is made more vulnerable by another's infection. So I'm going to come at this from a health perspective, that's my training, and think about what we need to have a strong and resilient health system for the future. So the first thing I think is important is universal health care. That means that everybody is covered. It doesn't, though, mean that just everybody is covered. It means that there has to be a lack of copays and there has to be adequate access. Waiting in queues for testing for some sort of COVID assay is not encouraging people, is not giving people equitable access, and will not ensure the public health results we want. The next thing I want to raise is the whole issue of dynamic efficiency, which I think we've forgotten. That is that systems have to have a certain amount of flexibility and agility and ability to innovate. And in my lifetime, it get tighter and tighter and tighter until there was almost no breathing space. And when we're affected by something as major as this, it's clear that we need the capacity for flexibility and agility quickly. The next point I want to raise is labour market conditions. Labour market conditions are a public health issue. If people do not have paid sick leave, if they do not have pandemic leave, there are very strong incentives for them not to adhere to public health measures. We know that there is extra vulnerability for people with insecure employment, and that's for the employee, it's for the co-workers, and it's for customers or people who are interacting with the workers. So labour market conditions are incredibly important in ensuring our resilient system. I want to then move to poverty. We've long recognised poverty and the conditions of poverty as a risk factor for illness. Poor nutrition, poor housing, just poor living conditions. But what we've seen, and I'm echoing Glyn very much here, is that poverty can be wiped out at a stroke by providing much more supportive incomes. And I look forward to some questions and discussion about the idea of a universal basic income. Accommodation also can, homelessness can be banished overnight, again, by fairly simple but radical policy approaches. And that too is part of our public health challenge in ensuring reduced circulation of the virus. I want to, because of this week that it is and the Women's Summit being held this week, to also say that the issue of secure housing for women and children at risk is particularly great and one that we should not overlook for a range of reasons, but a lot to do with our health reasons, not just their right to dignity and security. That takes us into education. And I'm going to again echo Glyn in saying that I do not understand why we do not provide free, high quality early childhood education. If ever there's a policy that has had long-term evidence for its effectiveness. And sure, it's important to get women back to work, but it's also important in establishing strong and resilient bases for our young children. And we know it will lead to fewer social problems, fewer physical health problems, and fewer mental health problems. Universities obviously are also important, but I won't go off on that sidetrack, Greg, because I know you want to get to the discussion. But what I do want to mention is our built design, I was going to say, you know, our urban design, but actually looking around, when you look at the country areas outside our cities, we're losing the country and becoming more and more suburbanized. But how we build the environments in which we live is absolutely crucial to also dealing with this public health challenge. The issue of ventilation, the issue of sunlight, the issue of adequate space. And that means the issue of open spaces for people's recreation and pastime. People cannot just be locked in boxes and assumed to come out with good health, physical and mental. The importance of transport within that. I could go into climate change, which is also a health hazard. It's a health hazard at the margin. Already we've seen higher mortality rates from warming, but also existential. But where I want to finish is probably much like you, Glyn, although I came at it from a different point. That is, government can make great and indeed radical revolutionary change. We've seen that. We've seen it happen very quickly if it has the will. But underlying that, the social contract with its citizens, the importance of trust is absolutely vital if it's to do that and do it effectively. All our big challenges, although I start with them as a public health problem, have political, social, psychological, moral, ethical dimensions, as well as health. And if we're not prepared to build that sustainability, we are not going to be rising to our challenges. The last 2 years have taught us a lot about how to deal with many of these things, but not how to affect the political and social will. Thanks, Greg. I'll stop there.
Thank you very much, Jane, and for persevering in the face of technological challenges that we all face from time to time, but it's really interesting to hear your insights from your professional expertise. And I particularly appreciated your comments about labour market issues, as that's a domain that I work in, and I'd like to encourage everyone to consider putting questions in the Q&A function. There are several already there, and I'm going to throw the first couple of questions initially to Glyn, but others of course can come in on these points. And the first couple of questions relate to JobKeeper, and Marcus observes that the results appear to have been positive, which raises the question why some form of universal basic income or similar philosophy would save a very large amount of administrative costs and stop the robo-debt approach and target the most vulnerable groups of people. And he's asking for any observations about this. And just to add to that, there's an anonymous question also to Glyn. How can the government be persuaded to make the transition from the concept of JobKeeper and other positive measures made in this pandemic to a guaranteed minimum income or something similar? And that anonymous attendee has just revealed himself as being Russell Lansbury. So thank you, Russell.
Greg, thank you very much. I'm very confident that in the very next session, as our incoming president, Richard Holden, speaks to us, he will reveal the answer to these questions, but I'll have a shot while we pen the revelation, because Russell's is the killer question. How do you persuade people who are opposed fundamentally to welfare payments to say more and better welfare payments are actually a fabulous and tested innovation? It's just been a random controlled trial in a town called Stockton, which is in the middle of California. And it's a poor town, it's a really poor town. And the mayor persuaded a foundation, Robert Wood Johnson Foundation, to fund a test of universal basic income. Not a huge amount of money, $500 a month to poor families to see what it did to behaviour. They did it over 24 months, properly tested, really interesting report available if you're interested. But it showed everything you'd expect, that families that received that money, it was enough to change their behaviour. It was enough to give them security of income to make them more risk-taking. And I don't mean that in a bad way. I mean, more willing to try their hand at other things. It gave them ability and confidence to apply for employment. So at the end of the 24 months, it improved health outcomes, it improved mental health. It had, as Marcus noted in his question, effectively, all of the outcomes were good. And it raises an interesting question, given we know all of this, and given you can actually do really significant cost-benefit studies about what a UBI might mean. And I think people often mistake a UBI for vast sums of money as opposed to a minimum amount of money to allow people to stay engaged in the economy and have a minimum standard of life. We now know this works. We've seen it tested. We've tried it out around the world. JobKeeper is not unique to Australia in any means. It's variations of across the Western world. We know it works. So the interesting question, and it's the question that Russell rightly raises, is what does it take? How much evidence do you need to persuade an electorate to change its mind? And we can talk about it in terms of the federal government. It's not the federal government, it's the whole electorate, because the government is in many ways a reflection of the prevailing views. So how are we going to do this is a question that I know Richard is going to answer with real clarity in his closing remarks.
So thank you, Glyn, and you're on notice, Richard. In the meantime, do any other panelists wish to comment on this particular issue?
I might just say something then, Greg. I think we ought to be clear about what job seeker was and what a universal basic income should be, so that we don't just argue for an extension of job seeker, because job seeker was carefully designed to exclude lots of groups. And I think obviously universities suffered from that, but the whole art sector, the creative arts sector, which has, I think, been worse than decimated in this country. And I think we're a poorer society for that, but perhaps that's just expressing my personal views. But if we're going to move, and we can do things quickly, we've seen that, but if it's going to be universal, it truly has to be universal.
Thanks, Jane. Any other panelists wish to come in? And if not, we'll move to some other questions. And there's a couple of questions here which I think Lenore might wish to respond to initially, at least. And Lucinda says, Lenore, what you've argued about the importance of social sciences contributing to navigating us through COVID. Do you and other panelists think Australia needs a chief social scientist? And if so, what role might the academy and others take in ensuring that happens in the current political climate? And also, Lenore, while you're on your feet, so to speak, you pointed out, as Amanda says, that income wasn't enough if services and infrastructure were missing. Should we be talking more about universal social services?
Yeah. Can I respond actually to both of them to begin with by saying that health is always a social event. It's not a biologic event that's somehow sequestered. And in that context, I mean, everything we've talked about today, including mental health issues, physical health issues, virology, epidemiology, immunity, and so on, are social issues. And so social sciences need to be at the front of this debate and not coming in at the back. And that's what I was arguing earlier. I think the problem with having a chief social scientist, although I know we have a chief health officer as opposed to a chief scientist, is that it then segregates the social sciences and keeps us on the edge. You know, oh, well, now we're going to talk about social attitudes. Let's ask the chief social scientist. I would much prefer to see a chief scientist of Australia being a social scientist. And why have we not had that? You know, we, a nation, consistently acknowledge and privilege particular kinds of voices over others, and that not, of course, also relates to ones of diversity, but I do think it's critical that we are involved and always included. And, you know, I mean, I'm consistently struck by calls, you know, South African government putting together committees and always having social scientists involved in acute recognition of how social science matters to the way in which the government and the society works. In terms of universal social services, yes, we need universal social services. We also need better infrastructure, and that includes in Australia. I mean, there is elsewhere a question around Indigenous Australians and Indigenous knowledge, but I'd like to go back and point out that most Indigenous communities suffer from appalling infrastructure problems as well as social structure, as well as income, and we still have not yet addressed that. And again, I would like to believe that if social sciences had greater purchase in different areas of government as an advisory group where research was better valued, then we might be a little bit ahead.
Thank you, Lenore. And do other panelists wish to comment on these matters? Certainly the chief social scientist suggestion is something I've raised personally at an academy AGM at least once. But the Academy at that point didn't wish to proceed with the notion for the reasons that you've articulated, I think, Lenore.
Yeah, I recall that, Greg. I think the role of social science is particularly important now because I think, as Peter Doherty said, this nation is a social experiment. It's an experiment in isolation because we're geographically separated, and Lenore's 18-nation study in her book is also a study on the way different places deal with these same issues. I think we we must be heard in terms of looking at the reforms that Glyn is referring to as being social experiments in which we take a look at before and after. The Canadian study seems to be a classic of what Donald Campbell would talk about as being social experiments as natural experiments in which you have no control group, or in some cases you do. You might have similar places, similar cities in which you can take a look at how it fares compared to the other. But I think that's a very, very special role. And the test, evaluate, try again, learn is very, very important. One of the things that I would ask of Glyn, and he and I share an interest in leadership, political for Glyn across the board in my case, is that what have we learnt and what can we actually suggest to the policy makers and our political leaders as far as what they could do better as far as taking advice and making decisions, because surely we've heard this morning they can do a lot better.
Do you wish to respond now to that, Glyn, or would you like to see that as a comment?
I assume Richard will pick this one up as well. So, yes. But I would say something, Leon, I think there's a parallel process here that's really important. If you're interested in governance and policy, we've abandoned the idea that in our public sector, we should have what in the right sense is redundancy. We should have levels of expertise and experience that we can call on in emergencies, that the public service is more than a just-in-time response. And it goes to a little byplay this morning with Pat McGorry around neoliberalism. I mean, it's the idea that there's depth in the public sector. One of the things I maintain is this has shown us just how thin much of our many of our public agencies are, and how little we've been willing to invest in that sort of profound expertise that we may only call on once in a generation, but needs to be there. And that's for me an important lesson about the architecture of how we go about policy making and who's in the room and who just isn't there anymore. And that's, I think, quite distressing.
Well, thanks, Glyn. Not only have we not invested, we've been disinvesting as a nation along the mantra of keeping taxes low or reducing taxes and so on, without recognising the positive value that the public services provide, which are highlighted at a time like this especially. But I'd like to go to a question from Karen, who asks, what opportunities are opened by the disruption of COVID to learn from other knowledges, including First Nations and cultural diversity? And that may be one for you, Lenore, to pick up as an anthropologist, if you wish, but any members of the panel would also be welcome, of course.
I'm happy to start it. And I think it really is an interesting question. And I think it is what opportunities are opened up. So, and it is the way in which discussions around COVID have sharpened, I think, also discussions around how we live, around planetary crises and planetary health, and around the emerging challenges for climate and urgency around climate change. And I do think that there is a respect for the environment and for relations between humans, animals, other non-human animals, and land and land care in different communities and cultures globally that do not pertain under sort of late monopoly capitalism. I don't think that we're going to see many changes to that general model in the short term, but every time I hear the implication from somebody around increasing growth as a way out of what's happened in the present, then I'm increasingly worried. And I think one of addressing issues of urgency around climate change is the next step. The more diverse voices, the better positioned we are to deal with these issues.
Thanks, Lenore. Do other panelists wish to comment on that?
There's a whole other world of discussion here around the way Indigenous communities have organised, self-organised around the Aboriginal health services or medical services to make a difference, and the depth of understanding about how organisation is the core to responding. And we could have a whole other session on this, but I've been watching with particular, I'm particularly impressed watching the way the community in Shepparton, which is the worst hit in the Victorian communities, has self-organised to make sure that there's an effective response with, for and by Yorta people. And it's a nice reminder that there are lessons to be learned, and it's more interesting question is how do we go and extract those and learn them and share them when this crisis is past.
Well, thanks, Glyn. We're fast running out of time, and we have talked about even having a follow-up symposium or an open mic, or Leon used the term a Hyde Park Corner symposium, to pick up some of these issues further. I'd like to squeeze in one last question, please, and that goes right back to some early remarks that Jeff Borland made in the first session, and he didn't use this term, but I will. We're seeing an Uberization of the workforce. So many people are working on a casual basis who, as Jane mentioned, don't get sick leave, and they may be tempted, because they don't get sick leave on a paid basis, to carry on working when they've got a virus, going into aged care homes or providing care to people in their own homes while infected and spreading the virus. In the new normal of living with uncertain pandemic futures, how can we reduce the percentage of the workforce who are working on such a casual or Uberized basis, rather than seeing this percentage tending to increase? Any of the panelists like to comment on that question?
Definitely one for Richard.
Okay, well, Richard, there's a lot resting on your shoulders, Richard.
No, it's a great question. It's just, it requires, in my case, more profound expertise than I could bring to it.
Well,
But I think the precarity around an Uber economy is new here, but it's not new for the majority populations and the majority of the world. It's always been thus. And what has been so apparent globally has been that the people who were hardest hit by COVID economically, as well as in terms of risks to health, were people who always lived precariously and for whom there were no measures. So that my point around social insurance and social assistance for South Africa was that they weren't entitled to grants. So the people who were poor but employed survived. The people who were not employed in the first place legally had to find ways to continue to eke out a living. And I think that really calls us to pay continuing great attention to how inequality shapes everyday life and disease risks.
Well, thank you, Lenore. And now on cue, we're going to pass the baton to Richard Holden, who's the incoming president of the Academy of the Social Sciences in Australia. And he's going to reflect on these important and topical discussions. He's a professor of economics at UNSW Sydney. And as well as being a fellow of this academy, he's also a fellow of the Econometric Society. And a few people have put questions on your table, Richard. So you've got a few minutes now to wrap up this whole symposium, and if you wish to address some of the questions that are on the table. Thank you, Richard. Take it away.
Thank you very much, Greg, for that daunting task. And I'm fortunate to be speaking from dark-and land on the New South Wales Central Coast today. Well, thank you first to Dennis, Greg, Jana and Leon, and everyone else who was involved in the organisation of this symposium. I've thoroughly enjoyed it personally. I think it's been a sort of uniformly impressive and terrific set of presentations and questions, and I've certainly both enjoyed and learnt very much from all the remarks. It was a pretty daunting job before Glyn handed me some sort of extra problem sets and homework to do to try and summarise all of this. So let me have a go at doing all of that as best as I can. So I think reflecting on some of the things that draw together what came from all three of the panels is that the COVID pandemic has taught us, and I think continues to teach us some important lessons about the administrative state in Australia. And my take on that is that we're typically very lucky in Australia. Now, it depends who you are in Australia, and that's a very important thing. But on the whole, and certainly by comparison with many other countries, we have a fairly effective administrative state. So anyone who's ever tried to get a driver's license in the United States, a wealthy country in aggregate, with a lot of resources, knows that that's roughly speaking an 8-hour procedure that is rather harrowing. And most things in Australia of that nature, getting a driver's license, getting a Medicare card, various other interactions with the administrative state, are much easier and much more effective. I think this pandemic has highlighted some of the good aspects of that and some of the bad aspects of that, particularly to do with inequality and the way that different people have had access to various programs. And I think in a sense, it's been a bit of a mixed bag. In 2020, the public health response that Australia had, at least I would grade it very highly. I think certainly compared to the rest of the world, in a situation with significant uncertainty and very meaningful challenges, our public health response was on the whole very good, and our economic response was on the whole very good. But there were notable sort of dark sides to that, in addition to the distributional ones. As Jeff Borland pointed out, JobKeeper may well have pumped a lot of money into the system and kept a lot of people afloat. It was almost surely over-inclusive in meaningful and important ways. The public health response, while very good, also sowed various seeds of failure, particularly with our vaccine purchasing strategy and our failure to build adequate purpose-built quarantine facilities. So it's been a bit of a mixed bag, I think, in that regard. In terms of the policy discussion, to be honest, I've been quite encouraged by the policy discussion in Australia. I think on the whole, we've talked about thinking about things relative to the right counterfactual, much like the discussion around mental health in the second panel today. We've talked in public fora about the costs of lockdown versus the costs of the virus, and acknowledged that while lockdowns might have cost, the cost of an out-of-control pandemic were very significant as well. And it wasn't just Peter Doherty talking about externalities today, it's other people in the public sphere, politicians, leaders, journalists, and indeed social scientists and scientists talking about the externalities posed by people not being vaccinated or taking other actions. And I think that's a very hopeful discussion. I think there are three things that occur to me that are questions going forward, if you like. One is around the role of experts. And I think in some sense, we've been very fortunate that we've deferred a significant amount to experts during this pandemic, something that perhaps we haven't done quite as well on when it comes to other important issues like climate change. But I think one of the challenges that comes out of this is the degree to which certain experts' processes and findings are up for public debate. So I think it's a reasonable viewpoint to say that some of the things that the TGA and ATAGI have done should be up for debate, and that those institutions shouldn't be beyond reproach. Speaking from a personal perspective, I've been very reticent to say much about that, because once people start, social scientists and other academics start criticizing experts, I think there's a real concern that a certain segment of the population will say, well, right, all expert advice is now inexpert, and so we don't have to listen to any of this annoying stuff about climate change and things like that. And I don't know what the answer to that question is, but I think grappling with the degree to which expert advice can be questioned in a constructive way or not is important. I think the second thing concerns freedom of expression and if you like, cancel culture. So I think that I personally think freedom of expression is incredibly important. There's certainly been a significant debate about that on university campuses in Australia. I think that's been on the whole helpful, and the responses have been quite positive. But I think there's an important issue, and again, I don't know the answer, is what happens if you have a colleague, to take a hypothetical example, if you have a senior colleague at your university, maybe in your department, who's an anti-vaxxer or a COVID denier, or perhaps say compares people who are in favour of vaccination incentives with Nazi scientists like Josef Mengele. And one thing that troubles me is we're in a situation, one thing that I think is good is that there's academic freedom on the whole, and that people are free to put their views, but that university speech codes or codes of conduct mean that when somebody does put a view like that, other people are hamstrung in their ability to respond to it. And I don't know what to make of that, but I think this pandemic has put those issues more to the forefront. And the third thing I'd say, and this really comes to Glyn's question, is I think we've started to see more sort of interactive discussion between the social sciences and the physical sciences, or in this case, the health sciences as well. And that's been very good. And Glyn raised a really nice point around types of evidence. So there are lots of types of evidence that are very important. Survey evidence is important. Case studies are important. Sort of detailed field work is very important. But increasingly in parts of the social sciences, things like randomized controlled trials and other means of getting at causation from natural experiments and other things have been really important. So in this debate about a universal basic income, I think that debate is much richer for the evidence that's been gathered from that, which is real causal evidence. And so in addition to the studies that Glyn talked about, my former colleague at MIT, Tavneet Suri, has done large-scale RCTs in Kenya on these questions, and I think we learn a lot from that. And I've been encouraged by the more interactive discussions between the physical sciences and the social sciences that have been part of this debate. Circling back to sort of where we started, these broad questions about the role of the state and the downsides of neoliberalism and other things, it raises a whole host of issues: Uberization of the economy, childcare, basic leave, healthcare, universal basic income, and many others. And since Glyn opened the door for me, I'll put in a plug for my thoughts about this, which is I have a book coming out early next year with Rosalind Dixon, who's law professor at UNSW, called From Free to Fair Markets, Liberalism After COVID. And that's our first stab at having an attempt to try and navigate a path and articulate a path between neoliberalism and democratic socialism that can say something about some of these issues. It's very imperfect, but I'll no doubt spam some of you with that at a later date. Thanks again to everyone for being involved, for the Academy and the organisers for for organising this. I think for me, this really represents part of what's fantastic about this academy and what we do, and I've thoroughly enjoyed being part of it. Thanks to all.
Thank you very much, Richard, for your thoughtful observations. And we've considered some important questions today. Thank you all for participating, and also those behind the scenes, with apologies to those whose questions we couldn't get to, but I hope that we'll have more opportunities in the Academy of the Social Sciences in Australia and more broadly to consider such questions. And I'm just going to mention a former president of our academy has commented privately in relation to the last question in the last panel that we should reduce Uberization, have a welfare system that enables people to refuse to work under those terms. So that might be a starting point for discussion of our next symposium or Hyde Park Corner or whatever we call it. So thank you, everyone, and not least the panelists that contributed so well, and everyone for participating, and Anna and Chris and the team behind the scenes. And keep well and wear a mask and stay safe and wash your hands, of course. Thank you so much.